for the reform of marijuana laws helped to organize a rally in Annapolis this lunch hour, and they are pushing Maryland lawmakers to legalize the use of pot. Joining me right now is Dr. Thomas Wright. He is the Chief Medical Officer at one of the country's leading teen substance abuse treatment centers, Rosecrance, and he's here to talk about the impact of marijuana legalization on teens. So you hear about what is potentially happening in Maryland, you know about Colorado, you know about Washington. Why are you concerned about the legalization or the decriminalization of pot around the country?
Well, at Rosecrance, we have a lot of concerns about it. I think the three most important ones are, number one, we're really worried that this gives a mixed message to our teenagers, that if you make it legal, we're fearing that the message that teenagers that are getting is that it's a safe drug and that maybe it might be a healthy thing to use. And almost all the time when that happens, teens start using more of it. We also worry too because their brains of the teenagers are still developing, and they continue to develop till they're 22, 23 years old. A lot of chemicals in marijuana, over 400, and a lot of bona fide sort of scientific studies showing it has effects on this brain development too. And then we worry about it as a gateway drug too. Is it going to lead to further drug use later on?
Is it too early to know what the effect is on teens in Washington and Colorado?
I think it's probably a little bit too early to know exactly what this legal effect is, but we do know from a ton of other studies as teens perceive this drug as being more available, they start using it more. And we do know from other medical legalization laws where they're able to use it for medicinal purposes that the rates of teen marijuana use increases as those laws become available.
We don't have a lot of time left, but what should parents do if they think their teens are using marijuana? Because you've seen the extreme of this. What should they do?
Well, I think that's a great question, and I think it's an important one. And at Rosecrance, what we always tell our parents is that you need to watch out for changes in your teen's behavior. You know your teen pretty well. Watch out for changes. Their grades are falling, their friends are changing, they might be more secretive about texting or phoning, and those are all signs that you should get some more help.
Dr. Thomas Wright from Rosecroft. I wish we had more time, but we don't. But thank you for your insights now.